Your physician probably hasn't brought this up during routine visits, but neglecting your sexual health past 60 can quietly harm your body. I've examined thousands of cases where older men who let go of this natural habit experienced avoidable physical decline. This has nothing to do with locker room jokes or moral judgments. We're talking about scientifically validated biological processes that influence your total health. I'm Dr. Katherine Rocker, a men's health expert and practicing urologist with over 20 years of experience, helping aging men regain their vitality, safeguard their prostate, and reconnect with intimacy, not just with their partners, but within themselves. You might assume self-pleasure no longer matters, but you'd be mistaken. This small, personal act plays a critical part in balancing testosterone, lowering stress hormones, supporting sexual function, and sustaining mental sharpness. When aging men stop, the body starts paying a hidden price. Blood flow to the prostate drops, cortisol builds up, and brain-derived neurotrophic factor levels fall. You may start noticing tiredness or longer recovery times. These are not random events. Today, I'll explain exactly how your body reacts when this key wellness habit disappears. We'll explore the real threats to your heart function, memory, and mental stability. The evidence is undeniable. Your sexual wellness is deeply tied to your overall strength. Before we dive in, make sure you hit subscribe and turn on alerts. I share straightforward, science-based insights made for men 60 and older who aim to stay resilient, sharp, and independent. If this topic matters to you, type 1 in the comments. If not, type 0. Let's see what the community believes. Now, let's begin with the most ignored effect of giving it up: how it silently speeds up muscle loss, low energy, and overall frailty. I've worked in men's health for over 25 years, and one fact I've learned firsthand is this: the body doesn't stop craving connection just because the birthdays add up. When sexual expression vanishes, a quiet breakdown begins inside. Your muscle tissue, the very fibers that let you move, carry, balance, and stay self-sufficient, starts declining faster than expected. This isn't just about desire. It's tied to strength, independence, and your ability to function in the future. Years back, I treated a retired builder named Harold, 82, widowed, and once proud of the hands that constructed homes across 3 towns. When he came to my office, he shuffled. He struggled to twist open a peanut butter jar. Within 2 years of losing his spouse and ending all sexual activity, his muscle density dropped sharply. He lost 12 pounds of lean mass, despite no change in nutrition. That experience completely shifted my perspective. I began investigating what's actually fueling this sudden physical decline. Then I met Margaret, 76, a widow who'd been living alone since her husband passed away. She came in reporting constant exhaustion and difficulty lifting groceries. Her hand strength had dropped by 40% in just a year and a half. Medical tests revealed fast-progressing sarcopenia, age-related muscle degeneration, much more severe than expected. Her hormone levels were unusually low. With no intimacy or sexual release, her body was quietly shutting down critical functions. Here's what science clearly shows. Sexual activity, including masturbation, naturally releases key anabolic hormones like testosterone and growth hormone. These vital messengers tell your body to protect muscle mass, repair after exertion, and maintain movement. Without those regular spikes, your ability to hold on to muscle vanishes more quickly. And the truth is, testosterone already declines steadily with age. But stopping all sexual stimulation accelerates that drop. You don't just lose strength, you lose your body's ability to resist muscle-wasting disorders. That's when independence begins to slip. By the time someone hits 80, nearly 50% of seniors show signs of sarcopenia. And along with it comes a spike in falls, broken bones, ER visits, and long-term mobility damage. It quickly spirals. As muscle mass fades, movement decreases, and less movement speeds up more loss. Today's clinical evidence finally validates what many experts in senior health have long believed. Sexual engagement, even through masturbation, has a measurable impact on maintaining physical resilience in later years. Multiple scientific studies now show that older men who keep up sexual activity enjoy better muscle preservation, healthier hormone balance, and steadier mobility than men who stop. One major review published in a top aging health journal discovered a strong link between sexual function and grip strength in men over 65. Another reported that those with frequent sexual activity had far higher growth hormone and testosterone levels, key to keeping muscles firm and age-related weakness at bay. When your body goes through arousal and release, your endocrine system responds by flooding your bloodstream with hormones your muscles need to stay strong and active. And the impact goes way beyond appearance. As muscle breaks down faster than normal, it affects your entire body. Your metabolism slows, blood sugar control weakens, bone density decreases, making you more prone to fractures. Even your heart starts feeling the pressure. A lack of sexual activity silently increases your chances of hospitalization, physical decline, and long-term dependence. I've witnessed men who once played tennis, hiked with their grandkids, or lifted grocery bags effortlessly gradually lose that vitality. Not purely because of age, but because their bodies stopped receiving crucial biological signals triggered by intimacy. When sexual expression is entirely absent, the body enters a state of understimulation. It starts conserving energy instead of building strength, declining instead of maintaining health. Masturbation should never be viewed as shameful. It's not something to hide from or feel guilty about. For countless seniors, it remains one of the final natural methods to spark hormone production, without medication, injections, or side effects. It's a science-backed form of self-care. So if you've been feeling weaker lately, if stairs seem tougher, or if your arms and legs appear to shrink despite eating normally, ask yourself, could your sexual wellness be part of what's missing? I'd genuinely like to hear from you. Have you noticed a drop in energy or strength in recent years? Do you think changes in your intimacy habits have played a role? Leave your experiences in the comments. It might help someone who's feeling the same way and doesn't know how to begin. Let's now explore how testosterone and growth hormone function as your body's internal repair crew, and what happens when that system goes unused. Robert, a 79-year-old, once bright, curious, and insightful, confided something personal during a recent visit. As he leaned in, eyes misty, he quietly admitted, "I feel like I'm fading." For months, he'd been waking up at odd hours. His emotions were unpredictable. Some days he was anxious, others completely drained. He had no motivation, no focus, and described a heavy mental fog. It wasn't dementia or memory loss. After detailed testing, the real cause became clear. Robert and his wife had stopped all forms of intimacy 3 years earlier. No physical affection, no solo connection either. His lab work revealed significantly lowered testosterone, spiked cortisol, the body's primary stress hormone, and irregular neurochemical activity tied to sleep and mood regulation. This situation is far more common than most realize. Many older men believe intimacy is something you grow out of, that it loses value in later years. But biologically, that's just not true. Sexual stimulation, including self-pleasure, triggers powerful biochemical reactions in your system. It prompts the release of oxytocin, which soothes the nervous system and fosters emotional closeness, and dopamine, which elevates motivation and mental energy. Serotonin, the neurotransmitter that stabilizes mood and governs sleep. And endorphins, your body's built-in pain and stress relievers. What began with Robert's restless nights and emotional numbness didn't end there. Once his hormone levels dropped, his body triggered a dangerous domino effect, one that silently strips many men of their vitality, without them understanding the root cause. It all starts with sleep. Disrupted hormone patterns throw off your body's internal clock. You find yourself restless at night, waking up exhausted, cranky, and unfocused. That sleep disruption sends your cortisol, the stress hormone, into overdrive. When cortisol remains elevated too long, your immune defense weakens. Inflammation becomes chronic, minor aches linger, cuts heal slower, energy vanishes, and even light tasks feel draining. Then comes the cognitive crash. Low dopamine makes it hard to feel motivated. The drive to begin your day disappears. Things that once brought joy now seem burdensome. Focus slips, and making decisions becomes more difficult. This isn't laziness, it's biochemistry. Meanwhile, oxytocin, the hormone responsible for connection and comfort, stays suppressed. Your ability to bond, even with loved ones, fades. Loneliness creeps in, increasing anxiety and emotional distance. Your body depends on a finely tuned chemical network to stay strong. When that balance breaks, serious consequences follow. Depression, cognitive decline, and faster aging accelerate. Many older adults become less active, more withdrawn, and increasingly reliant on outside help. But that future isn't set in stone. Sarah, a 74-year-old widow, came to me struggling with fatigue and a lingering low mood. She hadn't engaged in any form of intimacy, solo or shared, for nearly 10 years. After a respectful, honest discussion, she chose to try something unfamiliar: self-pleasure. Within a few short months, her body began showing signs of change. She started sleeping through the night once more. Her thoughts became clearer. Her sense of meaning and energy returned. Follow-up blood work revealed substantial hormone improvements. Under her doctor's guidance, she even lowered her antidepressant dosage. This was simply biology functioning as it's designed to. There's a widespread myth that sexual activity in older age is unnecessary or even inappropriate. But reality tells a different story. Ongoing sexual stimulation, including masturbation, isn't indulgent. It's a natural, essential method for maintaining hormone balance and emotional stability. Avoiding the subject only delays true healing. And that silence can quietly subtract years from your life, physically and emotionally. In the next section, we'll examine how these same hormone disruptions don't just blur your mental clarity. They also silently raise your risk of serious heart conditions. When hormone production declines due to a lack of sexual activity, the effects extend far beyond fatigue or mood swings. There's a deeper impact, one that directly affects your cardiovascular system. This link is both real and measurable. When sexual engagement stops, the heart and blood vessels lose a key source of organic stimulation. Over time, this internal silence starts creating damage. James, a 68-year-old former executive, came to me 6 months after a heart attack. His lab work showed a steep rise in blood pressure and increased vascular stiffness compared to the year before. What changed? He had stopped all intimate activity, partnered and solo, after dealing with erectile dysfunction. Embarrassed, he withdrew from intimacy entirely, believing that avoidance was safer than failing. But that silence came at a cost. When James finally opened up, he was shocked to learn that sexual inactivity wasn't harmless. It had played a direct role in his heart's decline. What many don't realize is that your cardiovascular system depends on consistent stimulation. It thrives on motion, circulation, and rhythmic exertion to remain healthy and adaptable. Sexual activity delivers all of that. Whether through connection with a partner or self-pleasure, these moments function as cardiovascular exercise. Your heart rate rises, blood vessels expand, and muscles engage. This improves blood flow, keeps your arteries flexible, and strengthens your heart's resilience. Sexual stimulation also triggers the release of nitric oxide, one of the most critical compounds for cardiovascular wellness. Nitric oxide helps vessels widen and relax. It reduces the chance of clotting, enhances oxygen delivery, and keeps arteries functioning at their best. Without this steady release of nitric oxide, blood vessels begin to harden. Circulation weakens. Blood pressure rises. These aren't random developments. They're signals that your heart and circulatory system are being deprived of the stimulation they need to function properly, and the consequences are far from mild. Research shows that men who stop engaging in sexual activity face sharply increased risks of heart disease, stroke, and even early death. These figures aren't just statistics. They represent real lives affected by a decision often rooted in silence and shame. While sexual inactivity impacts men and women differently, the toll on the heart can be substantial for both. In women, a lack of sexual stimulation means reduced support for natural estrogen production. That decline speeds up cardiovascular aging. Studies have found that postmenopausal women who remain sexually engaged show improved heart health, lower blood pressure, and more flexible arteries compared to women who are completely inactive. The activity itself helps hormone-sensitive systems stay active longer. For men, the danger unfolds through a separate, but just as serious route. When sexual activity stops, testosterone levels begin to decline. That drop doesn't just reduce desire, it affects the heart. Low testosterone has been strongly associated with increased risk of cardiovascular illness and impaired blood vessel performance. Over time, this can lead to erectile dysfunction, creating a destructive cycle. Fear of failure leads to withdrawal. Withdrawal harms the heart further, and the cycle deepens. But it doesn't stop there. Weakened cardiovascular fitness appears in everyday moments, often subtly at first, but with draining effects. You may feel winded after short walks. Your energy crashes by early afternoon. Rising from a chair takes more strain than it once did. These aren't just signs of getting older. They're clear warnings that your body lacks the stimulation it needs to stay resilient. This kind of fatigue often drives quiet changes to how you live. You might begin turning down invitations. You might stop showing up to events. Gradually, isolation grows and your world starts to shrink. What's most painful is this. Many doctors only treat the outward symptoms: elevated blood pressure, poor circulation, or low energy. But they rarely ask if sexual inactivity might be at the core. Too many people quietly accept weakening heart health as just part of aging. But that's not the whole story. In many instances, the heart can be strengthened again. One of the most overlooked ways? Consistent sexual stimulation, even through self-pleasure, can reawaken the body's natural support systems within your body rely on regular stimulation. Your heart is a muscle, and just like any muscle, it thrives on consistent, healthy activity. Circulation improves, blood pressure stabilizes, and energy levels surge. So if fear or shame has kept you from engaging, know this: there's still time to reclaim your vitality. Your body is still responsive. Your heart still wants to serve you. Beyond cardiovascular decline, sexual inactivity often brings another harsh reality. Many older adults endure in silence, ongoing, intensifying pain. What rarely gets discussed is this: your body is equipped with a built-in pain relief system, and it depends heavily on one factor: consistent sexual engagement. Let me introduce Eleanor. She's 81, a retired nurse, independent, bright, and strong-willed. But recently, she came to me in tears. "Doctor, nothing's working anymore. I hurt everywhere. I'm exhausted and I can't sleep." For years, she fought arthritis. Medications brought only brief relief. Eventually, even those stopped helping. Her sleep fractured, her fatigue worsened, and no solution eased the pain. During a longer consult, she shared more. After her husband died 5 years ago, she completely shut down sexually. No intimacy, not even private touch. The worsening pain soon followed. This isn't unusual. Sexual inactivity brings more than just emotional distance or loneliness. It rewires your body's chemistry. Without stimulation, you stop producing vital neurochemicals, endorphins, oxytocin, and other natural opioids that ease pain and calm the nerves. These chemicals don't just lift your mood. They physically interrupt pain signals. They travel the exact neural routes targeted by pain medications, but naturally, with no side effects or dependency risk. Engaging in any sexual activity, including self-touch, prompts your brain to release them. Their levels build during arousal and peak at climax, delivering hours of pain reduction, deeper sleep, and a more relaxed body. When that ends, so does your body's defense. The internal system quiets down, pain intensifies, sensitivity grows, and medications often lose their edge, because your body has stopped supporting itself. Research confirms this. Older adults who remain sexually active consistently report less chronic pain and a stronger threshold, not because of chance, but because their systems still create the chemicals yours once did, and the effects are far-reaching. Without that internal support, nights grow longer. Sleep breaks up. You wake up stiff and sore. Physical discomfort escalates. And so does emotional strain. When your body stops producing enough endorphins, it doesn't just leave pain unchecked. It starts shifting your daily life. Slowly at first, then suddenly. Eleanor, the retired nurse, got caught in this downward loop. Month after month of unmanaged pain left her leaning harder on pills. Side effects piled up. Brain fog, digestion issues, even her balance declined. She lost confidence in normal routines. She stopped walking her dog, stopped social visits. Her world slowly shrank. It wasn't just physical pain. It was emotional retreat. That's what people miss. When pleasure fades and pain rises, the emotional toll becomes just as heavy. You feel more distant. Energy dips into apathy. Pain triggers low mood. Anxiety creeps in. The spark of life starts to fade. That's the trap. Less pleasure leads to less movement. Less movement worsens pain. Then come sleepless nights, more exhaustion. And before you realize, your risk of disability and even early death begins to rise. But Eleanor's journey didn't stop there. With patient encouragement, she began reconnecting with her body. No pressure, no shame. Just small, steady moments of touch and self-kindness that reactivated her brain's natural medicine chest. By month 3, Eleanor was sleeping through the night. Her arthritis flares started to ease.